So friends, today we'll be dealing with the third part of susceptibility, in which I'll be telling you the views of different authors. Views by Roberts, Stuart Close, by Kent, and from Dr. Dhawale's book also. Now, let us go to the view by Roberts. Roberts says that everything that has life is more or less influenced by circumstances and the environment. Example, the vegetable kingdom, the animal kingdom, but the best example is seen in human beings. So now let us see what Robert has to say about each of these examples. From the vegetable kingdom, he says that certain plants or certain flora, they grow under certain specific conditions. So if these conditions are not there, the plants or the flora of the plants will not be able to grow. For example, he said that in the state of Connecticut in America, the peach trees were growing, and the trees were giving good fruits of peaches to the people of Connecticut. It so happened that one day all the peach trees started dying, and for about 50 years, no peaches were grown in the state. So Mr. J.H. Hale, he took a soil sample and he discovered that there was a lack of potassium in the soil, as a result of which the trees died. So he supplied potassium to the soil, and once again, the luscious peaches started growing abundantly in the state of Connecticut. So this tells you that the peach trees were susceptible to the lack of potassium. So if potassium was normal in the soil, the peach trees were growing well, giving good fruits. If the potassium was less in the soil or absent in the soil, then the trees died and they did not give any fruit. So this shows that the peach trees were susceptible to the lack of potassium. Once potassium was supplied, again the trees grew with good peaches. Now let us see an example in the animal kingdom, what he has to say. So he says that different animals from different parts of the world, they have an habitat whereby they thrive, they live, they reproduce, and they flourish. So certain environmental habitat is necessary for different species of different animals to grow and flourish. He's given an example for polar bear. So the polar bear is immune to the regions in the Arctic region. So it can bear the excessive amount of cold and it can thrive there. But if the polar bear was brought to a warm, humid climate, the polar bear would be susceptible to the heat and the polar bear would no longer survive, or the polar bear would die. This shows that the state of susceptibility, or whatever the animal is used to, that specific climate has to be there, or else the animal would be susceptible and the animal may not live. However, he furthermore says that the best example can be seen in the human beings. Out, he gives an example saying that one person can thrive in a rigorous climate, whereas one person would fall seriously ill. One person can stay at high altitudes, whereas the other one would not be able to stay. Some people can stay at the seashore and their health improves, whereas some people will succumb to the climate of the seashore and their health will deteriorate. Some people can assimilate certain kinds of food and the same food for the other people would not be suitable. So therefore, we say that one man's food is another man's poison. So in such ways, examples Robert has given. He further says that susceptibility is an expression of a vacuum in an individual. And he gives you an example stating that contagious diseases are more prevalent in childhood. Why? Because in, because the host or the child is constantly subjected to the environmental influences, and it is the external susceptibility of the miasmatic influence which makes the child sick, and it creates an vacuum in an individual. Now, this vacuum can only be fulfilled by homogeneous substances and not heterogeneous substances. That means what? It can only be fulfilled by giving a similar remedy and not a dissimilar remedy. So, when a person, or when a child has a contagious disease, a vacuum is formed. This vacuum has to be fulfilled by a homogeneous substance, that is the simillimum, or an indicated homeopathic remedy. So, once the vacuum has been fulfilled, the susceptibility has been met with and immunity has been inferred. So, therefore, infectious diseases, they only thrive in childhood. So he's compared it to an vacuum. Homeopathic application of remedy is a classical illustration of filling the vacuum in a sick individual, which I've already told you. And furthermore, he says that susceptibility varies in different degrees in different patients, according to the age, temperament, constitution, occupation, habitat, etc., which I've told you in the part 2 lecture. And susceptibility varies at different times in the same patient. So the same patient is there, but at different times it will vary. For example, it may be high in the morning, low in the night, or it could be high in the winter, low in the summer, and so on and so forth. Now let us see the view by Stuart Close. So his definition is that it's the general quality or capability of a living organism of receiving an impression and the power to react to it. So this I've already told you in the first part, the definition of susceptibility, or the two important points which are required for susceptibility to take place is: number one, you have to receive the impression and you have to react to the stimulus. This is what Stuart Close has to say. So he says that susceptibility is basically a fundamental attribute of life. All the physiological and pathological processes, they depend upon the state of susceptibility. For example, all the vital processes like assimilation, digestion, nutrition, repair, secretion, excretion, anabolism, and catabolism, all of them will arise because of susceptibility. So, the body has to work in conjunction or in harmony with all the physiological processes in our body. Then only we can say that the susceptibility is normal and the person is in a good state of health. And moment this susceptibility is altered, then we come into an pathological process, or we come into an disease process. Furthermore, he says that there's a relation between drug proving and disease expression. That when we prove a drug on a healthy individual, we get signs and symptoms. So these signs and symptoms are nothing but the expression of susceptibility of the patient. And in a disease individual, when a person is not well, we form the totality, and we, with our knowledge of Materia Medica, we identify one remedy which will be most suitable to the patient on symptom similarity. So therefore, we call this medicine as the simillimum. So therefore, Stuart Close says that only a homogeneous stimulus will be essential to pave the way to cure. So health, disease, action of a remedy, cure, reaction, immunity, all of them depend upon susceptibility. So as it is correctly said that susceptibility is a pivot around which homeopathy revolves, because susceptibility is a very big umbrella under which we are getting many factors which are responsible for the different reactions of susceptibility, like health, disease, action, remedy, cure, uh, cure, disease, etc. So he furthermore says that the susceptibility can also be altered due to drug induction or taking of a drug. Now, which drugs, especially, he has said chemotherapy, antibiotics, and the administration of cortisone, or the steroid group of drugs. It can also be the, the antipathic mode of treatment, or by giving different stimulant drugs or drugs which are depressive in action. So, when the patient is subjected to such harsh treatments, then the susceptibility will also be altered. So, this is also another important point to keep in our mind. Then, deficient reaction or diminished susceptibility. Out here, he says that in a chronic case, we have taken the totality and we are given the simillimum. But a point in time comes when the improvement ceases, and the well-selected remedy, it doesn't act any further. So under such circumstances, Dr. Dhawale is saying that you give a dose of what is known as an intercurrent remedy, which will generally be a nosode and which will help to pave the way to cure. So in such a state, the susceptibility is diminished or the reaction is deficient. So in order to stimulate it, you have to interpose a nosode. So initially you have given the constitutional medicine, patient has come to a standstill, then you have given a nosode, and this nosode removes the block and it allows the constitutional medicine to act to its fullest extent. So after giving the nosode, again you repeat the constitutional medicine, and whatever block was there, that has been removed. So naturally, the constitutional medicine will unfold itself to its maximum extent and the cure will take place. However, he also gives a point about extreme susceptibility and how to manage it. So in case of extreme susceptibility, also it is quite difficult to manage, because in such cases our medicine, they will not act. Why? Because the susceptibility is extreme. That is what? Either too low or it is very, very high. So extremely low susceptibility or extremely high susceptibility, our medicines will not act. So in such instances, please remember, make use or take help of the allopathic system of medicine. Give the allopathic system of medicine, give the medicines, and or refer the patient to the allopathic doctor. And when the susceptibility has come up to an appreciable level, then only our medicines will act. So the susceptibility was very low. After giving allopathic medicine, the susceptibility comes up to a level which is, to which our medicines will then react. So please remember, when susceptibility is very low, our medicines will not work. When it's very high also, it will not work. When it's very high, you have to take use of allopathic medicines, get it down, and then only our medicines will act. For example, I can give you for an very low susceptibility, let us say a state of meningococcal infection of the adrenal glands. It is a life-threatening condition. Patient goes into a comatose state, and the susceptibility is extremely, extremely low or very, very low. So in such instances, the simillimum will not work. So what do? We have to take care of we have to give allopathic treatment or refer it to an allopathic doctor or admit the patient in an hospital. Naturally, such patients will not stay at home because they're very serious. So you have to give replacement therapy, you have to give appropriate antibiotic or steroid therapy, and then accordingly, then when the susceptibility, which was very high, it comes down to an appreciable extent, then only our medicines will act. So please remember, when susceptibility is very high or very low, our medicines will not act. you have to take the help of the modern medicine. Now, let us see Kant's view. He has explained it or correlated it with the aphorism number 30, 31, and 32 with susceptibility. Now, this I've already told you in detail in the part 1. So I will not be again repeating it here. So Kant has given importance to potentization and repetition of the dose. So out here, he says when to again repeat it, and because of potentization, the susceptibility in the drug has been, or rather is evolved. More you potentize it, more higher the state of susceptibilities. So curative remedy must be on the same plane as that of the disease manifestation so that the susceptibility is satisfied. So he also agrees with close views, saying that in order to satisfy susceptibility, we have to have an homogeneous substance and not an heterogeneous substance. So by doing so, this will cause a suspension of the influx and the cure will take place. Furthermore, Kant says the medicinal force is superior to the disease force, and potency can be changed in different degrees to suit the susceptibility of the sick. So the medicinal force is superior to the disease force. Why? One point is that in the medicinal force, we have various levels of potentization so that we can administer to the sick person and the person will be all right. So therefore, it has different degrees to suit the different state of susceptibility of the sick. So therefore, medicinal force is more superior. So the question Kant says, when does a medicine that has been administered cease to be homeopathic? So he's given an example of lachesis. So he says, suppose you have a case of diphtheria, and after studying the case, lachesis appears to be the most similar of all the medicines, and one dose is given. So you studied the case, you found out the totality, it is of lachesis, and one dose has been given. So now Kant asks the question that when does lachesis cease to be homeopathic? So that means what? When will you repeat the next dose? Or when will you say that the lachesis is unhomeopathic to the case? So naturally, when the symptoms that have indicated are changed and they are now no longer present in the patient. So at this time, if you give the lachesis, the second dose of lachesis, it will naturally operate on a different level because the susceptibility has been changed and it is not homeopathic to the case, and it will act depressingly and not curatively. So basically, you have to take care that in a case of diphtheria, when lachesis is indicated, you have given one dose, all the expressions disappear, patient is quite all right. Then the second dose, if you give, it will be unhomeopathic. Why? Because the second dose doesn't call for lachesis. Why? All the symptoms have been ameliorated. So in such instances, just give a placebo and wait and watch. If you repeat lachesis, it will act depressingly and not curatively. Why? Because lachesis has acted at one level of susceptibility, and as a result of which the abnormal susceptibility has come back to the normal level. So if you have again repeated lachesis in the same potency, naturally it will vibrate at a different level. So it will not coincide with the normal susceptibility. It will vibrate at a higher level. So it will be unhomeopathic to the case. So this is what Dr. Kent has to say about the example of lachesis and when it is unhomeopathic to the case. He furthermore says Thus, in repetition, it has to be kept in mind that the first dose should completely finish the action, or else the reaction of the individual will be prevented. So that means what? Whatever dose you've given for as a first prescription, let it completely unfold its action to the maximum level. If you do not allow it, and if you again repeat the dose, then you will cause more damage to the patient. Drug induced diseases cause a lifelong disorder in an individual. He again further tells us that the human beings are constantly drugged by the modern medicine, as a result of which a drug induced disease is induced in an individual. So, if a drug induced disease is induced in an individual, it becomes very difficult to treat. He says it takes years of careful prescribing to turn them into a state of order. So here, Dr. Kent is indirectly hinting at the drug miasm, which I've taken up in my lectures on the role of pathology and homeopathy. Now let us see Dr. Dhawale's view. He has given a very nice definition, saying that it is an inherent capacity of all living organisms, all living things, to react to a stimuli in the environment and represents a fundamental quality that distinguishes the living from the non-living. So, it is an inherent meaning an inborn capacity of all living organisms to react to a stimuli. So, the stimuli can either be external stimuli like the environmental factors, or it can be the internal stimuli, that is all the normal physiological processes. So, how the person reacts to the external and the internal stimuli, it will depend upon the state of susceptibility. If the susceptibility is normal, if the internal stimuli is all working in coherence with all the other parts of the body, all the other functions of the body, then health will be maintained. If susceptibility has been deranged, it gets abnormal, and the internal processes go in a state of chaos, or in a case of disequilibrium, and the disease comes into play. And furthermore, he always says that it is a quality that distinguishes the living from the non-living. All of us have told you the same thing, that it is a fundamental quality that distinguishes the living from the non-living. That means what? Only living things will have susceptibility, non-living things will not have. Furthermore, he says it forms the very basis of continuous existence in the world. So because of susceptibility, all the living things in this world are alive. Susceptibility can be seen when the host meets the environmental factors. As I told you, when the host is there, it is constantly bombarded with the environmental factors, and when the susceptibility gets deranged, the disease sets in. And this is seen through the signs and symptoms. So the signs and symptoms signify the reaction taking place within the organism, which is nothing but the expression of susceptibility. Now, Dr. Dhawale gives many points regarding the susceptibility and its important role. He says that susceptibility plays an important role in the following points: maintenance of health, in the maintenance of evolution of constitution, development of diathesis, development of disease and its manifestation, process of recovery and cure, evolution of drug picture, manifestation of remedy and remedy reaction, and determination of dose and repetition. So let us see one points. So regarding maintenance of health. So in the organism, perfect balance represents health. The delicate or fine balance is maintained even in the presence of adverse environmental factors. This is possible only when a cell, that is the unit of life, it exhibits what we call normal susceptibility. So any change in the normal susceptibility will be reflected as a loss of balance or disequilibrium in the organism, which is evident by the development of disease. Hence, normal susceptibility is essential for maintenance of health, and disease is a result of abnormal susceptibility. So, in a nutshell, he wants to say if your susceptibility is normal, you are healthy. If it is abnormal, you are in a disease condition. Second point in the evolution of the constitution. So he says that each individuals have a different genetic pattern, and we have to perceive the attributes at different levels. At which levels? At the emotional, intellectual, and the physical levels. All this will be determined by the state of susceptibility of an individual. So the genetic pattern is different, which is evident to the predisposition of the patient, that is the fundamental miasm on the family and the past history, and the possession of attributes on the emotional, intellectual, and physical sphere will be seen from the disposition of the patient, which is partly inherited, but mainly it is acquired. So out here, for the evolution of constitution, the predisposition and the disposition are important indicators of the susceptibility. Now, development of diathesis. So there are certain attributes of certain diseases are there which can be equated to the miasm. So the attributes of diseases can be equated with the miasm of sora, psychosis, tubercular, and syphilis. So therefore, we say that diathesis represents certain deviations in susceptibility which are not sufficiently well marked to label them as a disease condition. For example, patient has a tendency to catch cold more in the rainy season, aggravated near the seashore, aggravated by eating juicy fruits. So this will indicate a attribute of the psychotic miasm. So the diathesis, as I told you, tendency to catch cold, aggravated by the rainy season, eating citrus fruits or watery fruits, staying near the seashore, all these are attributes which can be equated to the miasm of the psychotic miasm. Then development of disease and its manifestation. So the individual is constantly bombarded by the environmental factors. The vital force is strong enough initially to resist these factors, or the susceptibility is normal, hence health has been maintained. But when these environmental factors are constantly bombarding the individual, what happens to the life force or to the vital force? It gets weakened, or it is not being able to adapt itself to the inimical or noxious environmental influences. So the susceptibility gets deranged, or which is normal, it comes into an abnormal state, or it gets deranged, and signs and symptoms are manifested. So manifestation of signs and symptoms is nothing but the derangement of the vital force. In short, or in other words, is nothing but the expressions of the of the uh, the deviation of the susceptibility, or of abnormal susceptibility. Now, process of recovery and cure. Here also, an intelligent physician will definitely take into consideration the characteristic symptoms which the patient exhibits when the patient is recovering or when cure is taking place. So therefore, the abnormal susceptibility is restored back to the normal susceptibility in cure and in recovery. Now, evolution of a drug picture. Now, drugs are capable of influencing the organism because of its susceptibility. And it can be classically seen in drug proving. So, when we prove a drug, we can consider the following categories. Number one, common symptoms in a large number of provers. So out here, it indicates a general response to the specific capacity of the drug, but it is of little use from the standpoint of identifying the drug. That means what? When you prove a drug, a large number of provers will give you common symptoms. So it just tells you it is the general response of the drug, but you will not be able to identify one drug from the other drug. Second instance you'll get is characteristic symptoms seen in a large measure in a large number of provers. So they indicate the specific capacity of a drug, and it establishes its identification. That means what? You are getting characteristic symptoms in a good number of people along with the modalities. So for example, let us see the first one, common symptoms in a large number of provers. Suppose we get, for example, burning pains. That's a common symptom in a large number of provers. It just tells you the general response of the drug and doesn't help us to identify the drug because many drugs have burning pains. Second, characteristic symptoms in a large number of provers. So let us take the example of burning pain, but the modalities are different. One is better by hot, one is better by cold. So out here, you'll be able to definitely establish the identification of the drug because of the peculiar modality. Or we may get characteristic symptoms only in a few provers. So this takes place when the prover is highly susceptible and it will tell you the evidence and of the specific capacity of the drug. So in a group of individuals, you are getting highly susceptible provers who will give you some symptoms in which a large number of provers haven't got those symptoms. Why? Because these few provers have a very high state of susceptibility as compared to the other provers whose susceptibility is not so high. And character symptoms in isolated instances only. So in such instances, or rather, this sort of an reaction will be seen in an idiosyncratic in an idiosyncratic prover. So when a prover is idiosyncratic, or that means what? In a group of provers, only one prover will be there which will have symptom which no other prover has given and which is characteristic in nature. That is why it is in isolated instances only, meaning only one person out of a set of 1,000 has given this characteristic symptoms. This tells you that the person is idiosyncratic. So as you all know, idiosyncratic people are best provers and they are horrible patients. Because why are they horrible patients? Because moment you give the remedy, they will get aggravated. So this is the way in which when you prove a drug, you may get these different combinations or permutation of the symptoms. Even the potency in which the drug is proved plays an important role. If you give the drug in low potency, it will generally give you the symptoms on a very general level or on the physical plane, whereas a high potency will generally affect the susceptibility on the mental plane and give you more mental symptoms. So low potency, if you would prove a remedy, generally it will give you on the physical plane and less on the mental plane. High potency, you will get good characteristic mental symptoms with a few physical symptoms also. So manifestation of remedy and remedy reaction. Here, Dr. Dhawale has given a very long explanation of different possibilities and the indications of susceptibility. So now let us see one by one. So of an acute onset. So he says that if a disease is of an acute onset, you know that the onset is acute, it is explosive, and the susceptibility is high or the constitution is robust, and therefore a high potency has to be administered. In an insidious onset, on the other hand, it shows us that the susceptibility is poor, and in such instances, we have to give low potency. We may also get well-defined characteristic symptoms on different levels, the mental level, the physical level, and the particular level. This calls for the simillimum to be given in the high potency. In advanced pathological states, where the susceptibility is very low and end organ damage has occurred, if we give a remedy with a high potency, then killer's aggravation will take place. So in such instances, when the advanced pathologies, the susceptibility is low, you have to give a low potency. In sensitive subjects, especially of the hysterical type, in such instances, we know that the susceptibility is extreme. So in such instances, the use of both high potency and low potency may cause an aggravation. So the best part is to stick to the medium range of potencies so that an unnecessary aggravation will not take place. So therefore, these sensitive type of patients are very difficult to cure, but they make good provers. Okay, so if you get such an individual, it becomes difficult for the physician to tackle such an individual because of the extreme state of susceptibility. Now, in an advanced case, indicating a deep acting medicines, some caution has to be taken place. So suppose you get an advanced case of an advanced pathology and the susceptibility fortunately is high, you will get characteristic symptoms. Okay. So Dr. Dhawale is saying that when you get these character symptoms, naturally you will be able to identify a deep acting remedy, like for example, silicea, sulfur, kali carb, phosphorus, or whatever it may be, calcarea, or whatever it may be, according to the symptom similarity. So Dr. Dhawale says that in an advanced case, when there are character symptoms and the susceptibility is not been hampered or tampered with, then in such instances, do not give the similimum or do not give the deep acting remedies. If you give it, what will happen? A tremendous aggravation will take place, or a violent reaction will take place, and there will be a downhill course of the disease. So, therefore, if one has a prior knowledge of this situation, one can administer a superficial acting remedy, and then later on, then later on give the deep acting remedy. So, in an advanced case where there is characteristic symptoms, susceptibility is high, first prescription will be a superficial acting remedy. Then only when the susceptibility is coming low, then only you can, or coming down, then only you can give the constitutional remedy in order to avoid unnecessary aggravation and downhill course of the disease. However, in a borderline case where you are not sure whether it is curable or not, or whether pathology is between reversible and irreversibility, and you're not sure which way the pendulum will swing or which way the seesaw will swing. So, in such instances, Dr. Dhawale said you have to give the constitutional remedy, and the the reaction will take place, and it is quite possible that the case could be curable. So out here he says that in the borderline case, by contrast, it will bear the storm and gradually it will get the patient back to the path of cure. However, in poor symptomatology, where the, the symptoms are very poor, why are they poor? Because of suppressive agents or suppressive treatment taken. So he says in such instances, you can give drugs like sulfur, soranum, or zinc in order to open up the case. And such remedies will be indicated in the rubrics: reaction poor, or discharges ameliorate, or suppression aggravate in the repertory. By doing so, the case will open up and retake the case, and you can again give the medicine on the totality of symptoms. Now, use of a nosode. He says, similarly, in an advanced case where the symptoms are characteristic and you have given initially the similar remedy, later on followed up by the similimum, and the case then comes to a standstill. For example, there is 80% improvement and 20% doesn't improve in spite of again repeating the similimum. So in such instances, Dr. Dhawale says that you have to give a nosode which may remove the obstacle, and once again you repeat the constitutional medicine and the remaining 20% will be taken care of. Now, a maze of symptoms are got when the patient has been indiscriminately taken treatment either from modern medicine or from different homeopathic doctors. So, in such instances, what will happen? You will get a variety of symptoms and you will not know which symptoms to take and which symptoms to leave out. So, Dr. Dhawale says that experience indicates that Nux vomica is a good helper in satisfying the morbid susceptibility and creating order out of this chaotic state. So, when too many symptoms are present, Dr. Dhawale is of the opinion, through his experience, you give Nux vomica and it will help the patient, or the morbid susceptibility will be satisfied and it will create some order in the chaotic state of the patient. So, in a patient who is recovering from an acute illness, the susceptibility is high. Therefore, the patient will exhibit a good number of symptoms which will unmistakably point to the constitutional remedy. And if you administer the constitutional remedy, it will completely and effectively cure the patient in a short span of time. So, therefore, he says that whenever a patient is recovering from an acute illness, susceptibility is high, you have to give the medicine according to the symptom similarity in high potency. Whereas in allergic patients, especially of a skin allergy, with reference to skin allergy, Dr. Dhawale says that the susceptibility is extreme or it is high. So the caution should be taken so as not to indiscriminately administer the higher potency with injudicious repetition. So Dr. Dhawale says in such patients that again difficult to treat, you have to do not give a very high potency, do not give a very low potency, give a medium potency and wait and watch and see the reaction. They are difficult to treat but not impossible. It may take a long time. So as you can see, this is a very long point in which he has given many remedy reactions or many situations of a remedy and what you will do. Now, next is the repetition of the dose. So out here he says that there are different views given. Let us see the different views by the different authors, what they have to say. So Robert says that as long as the patient is improving with one potency, do not repeat, do not change it to the next higher potency. So as long as one potency is helping the patient and the symptoms are being ameliorated, do not increase the potency. This is Robert's view. But Kent had a different view. He said that each potency cannot be repeated for more than 2 times. For example, patient comes to you, you're given remedy A in 30 potency for 2 times. The third time you have to give the 200 potency and not the 30th potency. This is Kent's view on repetition. Of course, Dr. Hahnemann's view in the 5th edition, where he had introduced the centesimal scale, he had said that infrequent repetition in a chronic case has to be given. And in the 6th edition of Organon, he has introduced the LM potency or the new method of dynamization or the 50 millisiemel scale, in which there was a higher ratio of drug dilution. And he said that the remedy can be repeated frequently, not only once a day, twice a day, 3 times or 4 times a day, but it can be also it can also be repeated every hourly, 1 hourly, 2 hourly, half an hourly, as the case may be fit with, and it will not cause an aggravation. So the new method of dynamization, he said, which he had invented, was much more better because you could repeat the medicine for a prolonged period of time without the aggravation coming. Now, in cases where the susceptibility is dormant, so in such instances, again, when will you get dormant susceptibility? Again, when it has been uh, when it has been subjected to suppression, which I've already explained to you before in the previous lectures. Now, something about local applications and susceptibility. So out here, he endorses Dr. Hahnemann's view by saying that in those local diseases, or rather in those local maladies, I repeat, local maladies which are of a recent onset and the vital force is not being deranged, a local application can be given. For example, in chilblains, in heat stroke, or in sunburns, it can be applied. A local application can be applied. Why? Because the vital force doesn't sympathize with the whole organism. Whereas in a case of a local disease, the vital force has been affected and the signs and symptoms appear on the external part of the body. That is through, for example, a skin eruption. So, in such instances, definitely the local application is not allowed. Why? Because the cause lies internal in the form of the miasms. So, in order to preserve the body from danger, the body throws it out on some other important part of the organ, for example, the skin, whereby the life can be preserved. So, therefore, the indicated homeopathic medicine can only be given internally in order to eradicate the burning fire of the miasms. So, once the miasms are eradicated, automatically the skin eruption on the surface of the skin will also be eradicated. Therefore, no local applications are allowed. Why? If you apply a local application, it is quite sure or quite possible that it may be the eruptions will disappear prematurely and the cause, that is the miasm, still remain active in the body. Or what are you doing? You are driving the disease again back into the organism from a less important organ to a more important organ, from the periphery to the center, and you're causing more complications. So this is what, again, Dr. Dhawale endorses Dr. Hahnemann's view. In suppression and susceptibility, I've already told you in the previous lectures also on pathology and homeopathy, as well as on the disease, different expression of the disease manifestation. I've explained to you in detail. Now, regarding palliation and susceptibility. So, when will you palliate? Naturally, you will palliate in those diseases which have an advanced pathology. So, on what law will you palliate? It is the same, the law of similars. So the medicine is selected or the remedy is selected on the law of similars, which will have a palliating effect on the patient in an incurable stage of disease. So therefore, when the disease is incurable, you're taking the similimum according to law of similars and you're administering it. So as long as the patient is taking the medicine, the patient will feel better. And if you discontinue the medicine or the patient discontinues the medicine, again the symptoms will appear. So palliation is the temporary reduction of the intensity of the symptoms without much affecting the state of susceptibility. But however, certain important points are to be remembered, or certain points have to be remembered. That is, number one, please, that in an advanced pathological case, please do not give high potencies when vital organs are involved. Otherwise, as I told you, you get a killer's aggravation. Second point, do not give a deep acting constitutional remedy. Always first give a superficial acting remedy and then later on give a deep acting remedy. And injudicious repetition should be also avoided. So your repetition should be very judicious in such cases. So I think so I've covered up everything from the books of Kent, Stuart Close, Roberts, and what Dr. Dhawale has to say. Now, part 4 will be the last part in which I will be telling you how to judge the susceptibility at the bedside, and I'll be demonstrating a case whereby it'll become very clear as to what I want to tell you. So please stay tuned for more. And if you like this video of mine, please do like, share, subscribe, comment, and forward this video. Thank you very much.